Good afternoon, everyone. I'm Dr. Disha Samantaray, here to present my case on capillary hemangioma with secondary glaucoma. I don't have any financial interest to disclose. To begin with, capillary hemangioma is a benign hematomatous vascular neoplasm of the orbit, which arises de novo and then undergoes clonal proliferation. They do not have any hereditary association, but 80% of them are known to resolve spontaneously by 7 years of age. And they have a female to male preponderance of 3:1. They're not present at birth, but they appear within the first few months of life and then gradually progress to a soft and spongy mass, which may blanch on pressure, but without any pulsation or bruit. They come in two phases. First, the proliferation phase from 3 to 12 months of age, where there will be vascular endothelial cell proliferations, which cause the formation of new vessels as well as anastomosing vascular channels. This leads to a mass which we typically know as the strawberry nevus. That is followed by the involution phase, which comes after 3 years of age, where all of this is replaced by fibrous tissue and hyalinization of the capillaries. The most common complication is usually ulceration and bleeding from the lesion. Coming to my case report, a 13-year-old male child presented to the OPD with a 4 into 3 centimeter soft, compressible, non-fluctuating swelling with ill-defined margins over the right upper eyelid extending towards the forehead that first appeared after 2 years of age and then became gradually progressive. There was recent development of nodular cystic lesions and bleeding from its surface. And there was also a similar history of swelling in the right nasal cavity, which was associated with epistaxis, until 5 years of age, after which it was spontaneously regressed. These are the pictures. So, for investigations that we did, the best corrected visual acuity in the right eye was 6/36 partial, and the left eye was 6/6. The extraocular movements were free and full in the left eye, but were restricted in the upward direction in the right eye because of the mechanical ptosis. On slit lamp examination, the bulbar conjunctiva, cornea, anterior chamber, and pupil of both the eyes appeared to be normal. The intraocular pressure of the right eye was 22 millimeters of mercury, and for left eye was 17 millimeters of mercury, measured by NCT at 12 p.m. On fundoscopic examination with indirect ophthalmoscope, the media was clear, CDR was 0.6 with deep cup and inferior notching of vessels in both the eyes. And on ocular coherence tomography, we found retinal nerve fiber layer thinning, which was in the inferotemporal area in the right eye only. We also did repeated HVF24/2 visual field analysis for this patient, but it did not yield any appropriate results as the patient was uncooperative due to the lid mass. On ultrasonography and CT of the nose and orbit, we found many heterogeneous soft tissue growth with multiple feeding channels from the superior ophthalmic, superficial temporal, and retromandibular vessels. The vitals of the patient were normal, so were the ultrasonography of abdomen, pelvis, MRI of neck vessels, and MRI of brain. But the patient had a history of severe anemia at 4 years of age with 1 episode of blood transfusion. The child was put on oral propranolol tablets 10 mg twice daily after food since 5 years. He was also started on timolol 0.5% eye drops twice daily. He underwent partial surgical debulking of the swelling under general anesthesia and also has been advised to repeat surgery after 6 months. The histopathology examination from the surgery revealed it to be a capillary hemangioma. Post-operatively, 2 months later, we found that there was no further bleeding from the lesion. The visual acuity also stood corrected at 6/9 best corrected visual acuity with refractive management, and the right eye IOP was also reduced to 14 millimeters of mercury, but the fundoscopic picture had no significant changes. These are the post-operative images. Now, capillary hemangioma can be divided into superficial, deep, and mixed lesions, in which the superficial is the visible mass producing astigmatism and amblyopia because of the pressure. The deep lesion usually produces strabismus or decreased vision due to pressure on the optic nerve, and it can be mixed type. The possible mechanisms of glaucoma in this case could be mechanical pressure on the globe because of elevated episcleral venous pressure or malformation of the anterior angle chamber. And there can be pressure on the optic nerve, which can lead to optic atrophy. The There are multiple systemic associations associated with capillary hemangioma, which can be other hemangiomas in the head and neck region, Maffucci syndrome, which is associated with multiple enchondromas and visceral hemangiomas, Cassibach-Merritt syndrome, which is a consumptive coagulopathy associated with the capillary hemangiomas in head and neck area, and also Faces syndrome. These are the differential diagnoses possible for my case, which include cavernous hemangioma, Sturge-Weber syndrome, Kaposi hemangioendothelioma, telangiectasias, and other carcinomas like squamous cell or metastatic carcinomas. So to conclude my case, I would like to say that with the targeted management of beta blockers as well as surgery, these complications of bleeding, raised intraocular pressure, and decreased vision were found to have reduced in this case. So even though capillary hemangioma is one of the most common benign childhood tumors and do not require any treatment in case of absence of complications, but we must individualize the treatment and cannot go for wait and watch for every case, as active management is required for progressive cases of capillary hemangioma such as this. These are my references. Thank you all.
Yeah, so Disha, thank you for being here and presenting an amazing case. So whenever we talk about oral propranolol, the indication of oral propranolol is during the proliferative phase. Yes. So he was a 13-year-old?
Yes, ma'am.
And he was on propranolol for 5 years?
Yes, ma'am.
Right, yeah, so that is something probably, you know, the proliferative phase is the initial phase, yes, and that's when the oral propranolol works.
Yes, ma'am.
So it doesn't work otherwise, you know, he's 13-year-old, right? Yeah, yes, so probably oral propranolol was not the right indication in this particular case, and it's been going on for 5 years, right? We don't give propranolol for this long, okay? So oral propranolol works in the proliferative phase. That is one take-home message. Did you consider triamcinolone, steroid injection, intralesional injection in this case?
Actually, madam, this patient presented to us in the very later phase of his life, after he had turned 13 years, and the lesion existed since he was 2 years of age. And because of the continuous bleeding from the lesions that had developed, he was already advised for oral propranolol from outside and no other.
No, did you consider injection? Was that a consideration when you were thinking of the management?
Yes, ma'am. We were considering intralesional.
Was it given? Intralesional triamcinolone acetonide was given?
No, ma'am, it was not given. Because of the active bleeding only, we wanted to wait a little before we can go for intralesional triamcinolone. But then he preferred to go for debulking surgery, which was done in association with the plastic surgery department.
Okay, that's good, but bleeding doesn't stop you from injecting. You know, you can always go for an intralesional. That is one of the treatment modality for capillary hemangioma that we practice. Yeah, thank you so very much. Thank you.